Hello, my name is Dr. Anwar Ali, and I'm one of the registrar at University Hospital Kerry. So today I will talk about the basic interpretation of ABGs. So first of all, let us talk about the normal values of ABGs. So the normal pH is between 7.35 to 7.45 of of Hg. So you can take 7.40 as a reference range. So the next value for ABGs is PCU2. So the normal value of PCU2 is 35 to 45 of Hg and the arterial blood gases. So you can take 40 of Hg as the reference value. So the next is the PO2. So the normal value of PO2 and arterial blood gases is between 80 to 100 of Hg. And the last one is the bicarbonate value. So it is between 22 to 24 millicolon per liter. So if the pH is below 7.35, then we will label this is acidotic pH or acidosis. If the pH is above 7.45, so we will label as alkalosis or alkalotic pH. So these two values are critical deciding about whether the patient has acidosis or alkalosis. So now I will present to you an example so that you can understand easily. So the first example I will take of acidosis, metabolic acidosis, because it is the most common cause of acidosis. It is one of the most common acid-base disorder in our clinical practice. So let's take the example a patient with the metabolic acidosis. So the history is a 45 years old gentleman presented in the emergency department with the increasing respiratory distress, abdominal pain, nausea, and vomiting, and hypotension. So the ABGs shows that the patient pH is 7.25. So here the pH is 7.25, so the pH is acidotic. So we know that this patient has the patient has acidosis. We don't know at this point that whether this patient has metabolic acidosis or respiratory acidosis. So the first question we have solved that this patient has acidosis. Now let's explore further the other values of arterial blood gases. So here we have the PCO2 value of 30. So PCO2 is 30. It is less than the reference value. So it is 30. Now we have the bicarbonate value of 15. So the bicarbonate value is 15. And the PO2 is 85. It is normal and range. So we have three range figure in the arterial blood gases. So the basic interpretation of ABGs here would be this patient has metabolic acidosis. So this patient has metabolic acidosis. So it means that the pH is acidotic. The next question will be why this patient has metabolic acidosis, why not respiratory acidosis. So if I tell you the simple formula ROME, ROME, so if you compare the pH with PCO2, it will be easy for you to understand the basic acid-base disorder. So if you compare the pH with PCO2, so the pH is coming down. Okay, it is 7.25. It is coming down. And what about the PCO2? It is also coming down. So both of them are coming down. So if the pH and the PCO2 both are coming down, so in the context of basic acid base disorder, you can take as take this ABGs is label this ABGs is this patient is having metabolic acidosis. So pH is coming down, PCO2 is coming down. So according to the Rome mnemonic, so R O respiratory opposite, metabolic equal. It means that the pH and the PCO2 will be in the same direction for metabolic disorder. Let's take the example of metabolic alkalosis now. So a patient with a pH of 7.50, okay, so the pH is now alkalotic, okay, the PCO2 is 48. So here the PCO2 is above the reference range. What is the reference range for PCO2? 45. So now it is 48. So we have two values. The pH is going up, the PCO2 is going up. So according to the Rome mnemonic, the pH and the PCO2 are both in the same direction. So metabolic equal. So in metabolic disorder, the pH and the PCO2 will be in the same direction. For the metabolic alkalosis, it will be up, but for metabolic acidosis, it will be down. So in this lecture, we have covered the two acid-base disorder, and that is metabolic alkalosis and metabolic acidosis. Now let us talk about respiratory disorder. So and respiratory disorder, as we have mentioned earlier, that for the respiratory disorder, the respiratory disorder, the pH and the PCO2 will be in the opposite direction. Let a patient, 25 years old gentleman, presented in the emergency department with the severe shortness of breath and wheeze and high temperature. So according to the initial ABGs, has PCO2 is PCO2 is 25. So the PCO2 is less than 40, so it is 25. Now what about the pH? The pH is 7.48, so the pH is alkalotic, and the pH is alkalotic, so the pH is moving up, going up, and the bicarb and the PCO2 is coming down. So both the pH and the PCO2 are in the opposite direction. So it means, according to the Rome mnemonic, this gentleman with acute severe asthma, he is having acute exacerbation of asthma, he is having respiratory alkalosis, because the pH is 7.48 is alkalotic and the PCO2 is coming down. So this is respiratory alkalosis. Now a second patient with the chronic obstructive airway disease, he presented in emergency department with shortness of breath, wheeze, and decreased conscious level, drowsiness. So the initial ABGs and the A&E showing the PCO2 value of 50, the pH is 7.30, and the bicarb is 32. So here we will focus on the pH and PCO2, because we are now discussing the basic acid-base disorder. So the pH is up, the pH is down here, 7.3. okay, and what about the PCO2? It is up, it is 50. So 7.30 is the pH, so the pH is acidotic, so this is acidosis, but the PCO2 is going up, so it is 50. So it means that the pH and the PCO2 are in the opposite direction. So according to the Rome mnemonic, this patient with COPD exacerbation is in respiratory acidosis. So guys, today we have studies about the basic acid-base disorder. We have studied the metabolic acidosis, metabolic alkalosis, respiratory acidosis. Hope this video will be quite helpful to you in interpreting about the basic acid-base disorder, and future we will discuss more in detail with examples to know about more about the acid-base disorder, to know its importance and the clinical scenarios, how to interpret ABGs, how to manage a patient with deranged ABGs, how we can do a quick action to save the patient from further deterioration. If you have some question, please put your questions to me, and I will try to answer all of your question. Thank you. Bye for now.